I've been stalling long enough. I think we need to get into the really difficult part of this discussion, which is what's happening right now in Gaza.
Just as you said, about 1.93 million people have been displaced. I think it's now over 20,000 fatalities, with 10,000 children being killed, and that's including the numbers that they suspect are under the rubble, because there's thousands of people that are actually missing and they're assuming that they're trapped under the rubble. And then you have the shelters on top of that, where some shelters, because depending on the size, there's 700 people to one toilet. So we are starting to see a proliferation of infectious diseases at a rate that is extremely scary.
And it's like no matter how bad you think it is, it always seems to be a little bit worse in reality.
So the numbers that we're seeing are definitely lower than what is actually happening on the ground.
Amira, can you tell us about the Palestinian Medical Relief Society?
The Palestinian Medical Relief Society was founded 44 years ago by Dr. Mustafa Barghouti. And so they essentially ultimately built the public health system. We're striving to ensure that the most vulnerable groups and demographics in Palestine have access to quality healthcare.
To my understanding, there's really two hospitals in southern Gaza at this point, the Nasser Medical Complex and the European Gaza Hospital. They are well over their capacity. Can you tell us a little bit or give us a little perspective on what's happening inside those hospitals right now?
They don't have enough supplies coming in. The staff aren't able to eat or hydrate themselves properly, let alone, have that then funnel down to the patients. There are patients everywhere, on the floor. Whatever space can be taken up is taken up. The hospitals are still being attacked and bombed. So the maternity ward and the children's ward of the Al Nasser Hospital was bombed just a few days ago. A lot of the time they are encircled by tanks as well. And, even just from a primary healthcare perspective, our clinics in the southern parts in Khan Yunis, for example, for days, have also been encircled by tanks. So it's extremely difficult. And a lot of the doctors that are there on the ground working are just, at best, we're a first aid station. And even then, that's becoming really difficult because of the lack of supplies and the amount of pressure that is on the health system. And we've seen the images of people working in the hospitals finding that their loved ones have been killed or injured whilst working in the hospitals, or picking them up in the ambulances. So I want to just highlight that when we talk about the pressures and the strain on the healthcare system, it's the people, that have really taken such a toll and somehow continue to push through and continue to try and take care of their patients in the most amazing ways.
Yeah, it's really impressive what braver medical professionals are out there. I don't think there are any. I know it's really hard. I know it's hard to get good information, but what are good resources for us to get data?
So WHO is actually the best at the moment because they lead the health cluster. So everyone working on the ground is feeding into WHO. So every week we send them a report from our teams about what's happening.